Delegate Hope. Delegate Orrock. Delegate Scott. Delegate Waxman. Senator Favola. Senator Hashmi. John Talaris. Amy Laufer. Connor Cummings. Gail Brunk. Madam Chair, you have a quorum.
Thank you. Okay, colleagues, I think we're going to launch right into our agenda, and it should be an interesting one. First item in terms of the content is a presentation on less restrictive income methodologies. Kelly Pauley, who is the Eligibility and Enrollment Manager at the Department of Medical Assistance, will be presenting, and I believe the presentation will be virtual. Is that correct?
Madam Chair, that is correct.
Okay. Ms. Pauley, if you're ready, we would be happy to let you into the room.
Okay, that would be great. Can you hear me?
Yes, welcome.
Okay, thank you. Senator Favola, thank you very much for inviting me. Do I need to run my slides, or is someone going to do it there?
If you have the capability of sharing your screen, you can go ahead and do that now.
Okay, I will. Thank you. Okay, are you able to see the slides now?
Yes, yes. I think as you go through them, I hope the image is large enough for everyone to comfortably see them.
Okay, and I'm sure we will also share the slides with you to have as a reference afterwards.
Yes, and I expect they would be posted so our viewers could also access the slides.
Okay. Okay.
Go ahead.
All right, thank you. A few months ago, the Disability Commission shared some information that they had received from Dennis Finley and Congressman Don Byers' office. So I reached out to CMS, to the Centers for Medicare and Medicaid Services, for more information about the flexibilities that were described in that information. On January 11th, 2001, CMS, the Federal Register, a final regulation that allowed states to take full advantage of the flexibility offered by Section 902R2 of the Medicaid statute. This is the use of less restrictive income and resource methodologies.
Ms. Pauley, would you speak clearly into the microphone? We're losing you a little bit.
Okay, let me just get closer. Is that better?
That's better. Thank you.
Okay, I'm sorry. Before they published this regulation, the states were greatly restricted in their ability to use less restrictive income methodologies under 1902R2. So the final regulation was effective on May 11th, 2001. The implementation guide, which
I think we've lost you again.
Oh, no.
Oh, okay.
The implementation guide, which is what Mr. Finley and Congressman Byers shared with us, conveys the information about the disregards that were already in effect, but the implementation guide doesn't do anything new itself.
Ms. Pauley, hold on. We're fixing the sound here.
Okay, thank you.
Please continue.
Okay, can you hear me better now?
We cannot quite yet.
Oh. All right, let me try one more thing on my end.
Ms. Pauley, if you are
Okay.
speaking, we cannot hear you.
Okay, I am speaking now. Can you hear me?
We can't hear you. Your volume is very low. Would you mind moving closer to your microphone?
Okay, and I will try to speak up. So, I will be calling this the 902R2. That's just the section number of the provision. It's sort of a shorthand expression.
Hold on, Ms.
I'm
Polly.
sorry.
We still don't have good audio.
I'm sorry, Ms. Polly, we heard you very clearly at the beginning, and we were trying to adjust on our end. So if you would please, I guess, do what you were doing at the very beginning, we'd appreciate it. Thank you.
Okay. I have the speakers up as far as they will go. Can you hear me?
Not really. It's super, super soft. Are you able to move closer to the microphone input on your computer?
It almost seems like she turned the microphone off. Did she do that by mistake?
I don't know. Let me see whether there's anything else I can do. Hold on one second. I apologize that you're not able to hear me better. Do you want...
Senator Favola, just FYI, in case it helps anybody, it sounds great apparently on the webinar.
So viewers are listening to it, and the commissioners can't hear it. And
That's not really good. Will Frank is there. Do you want him to read the slides to you?
is it possible for us to get this fixed?
What I'm wondering is if we can go to the next one.
And, okay. All right. So what we're going to do, colleagues, is we're going to move to the next item on the agenda, if that's okay. And then perhaps staff can figure out how we can get a good presentation on the less restrictive income methodologies. Okay. Why don't we move to our second presentation, which is Priority Needs for Independent Living. Maureen Hollowell is an advocacy coordinator with the Virginia Association of Centers for Independent Living. Bless you. Welcome. Good afternoon.
This presentation builds on the presentation that you heard in April. So a lot of the details that we talked about in April, I'm not going to repeat that information. But Virginia Association of Centers for Independent Living is a membership organization representing the 17 centers for independent living. These are nonprofit, non-residential, consumer-controlled organization. The majority of our board and staff and management are people with significant disabilities. And so in April, at your last meeting, we had brought a number of concerns and issues, ways that those concerns could be addressed. And then we, of course, heard from you all that you would like us to prioritize some of those recommendations, which we took to heart, and the disability community in those 17 locations. Thank you. Those 17 locations talked about the issues that were discussed at the April Disability Commission meeting, and they prioritized 4 funding recommendations, 3 recommendations that would not require funding, and recommendations that could be pursued by the 17 Centers for Independent Living if additional funding was provided. So the funding recommendations specifically, one is in regards to Medicaid transition coordination for people to get out of institutional settings such as nursing facilities, increase the state rate for personal assistance services, And this would be both through the Medicaid program and the Department for Aging and Rehabilitative Services. Fund 5 new centers for independent living in unserved areas, and fund existing centers for independent living to address the number of issues that were raised at the April Disability Commission meeting. So the recommendations that would not require any funding, one is that this year there was Senate Bill 839 that was passed regarding housing affordability. One of the biggest things we raised last meeting was people with disabilities who are living on SSI or the average amount of SSDI simply can't pay rent. They can't afford to live anywhere. And so one of the things that we would recommend is that this commission receive a report from the Department for Housing and Community Development about the progress with Senate Bill 839 regarding housing affordability. They've included some stuff in that bill regarding housing accessibility. We see the real need for focus on affordability, but hopefully the report would address both issues. The second item that would not require any funding is to request a study to determine how the auxiliary grant can be used to support people in their own home. And as addressed last meeting, the federal government allows states to fund a supplement, money, to supplement the supplemental security income that a person with a disability receives through the Federal Social Security Administration. And in Virginia, there is a supplement, but that supplement goes only if the individual lives in a segregated auxiliary grant assisted living location instead of living in a more affordable, their own home. And this would address issues with integration, it would address issues of affordability, and hopefully open up housing options for individuals with disabilities. And the third recommendation that is not connected to funding would be to modify the Virginia Building Code to expand the number of Type A units that have to be accessible. And as discussed in April, this is a number of multifamily dwelling units that would have to be made accessible in new construction. Frankly, just the number of accessible units just aren't there. So on the housing recommendations, the three that you see there in red are the things that we just went over. Okay, the supplement to the SSI, looking at the report that comes from Senate Bill 839 as a commission, and then increasing the Type A unit requirements in the building code. One of the other big issues from last meeting was the lack of access to and lack of accommodations available in shelters, homeless shelters. Because people can't afford to live anywhere, they're relying more and more on the homeless shelters. And there is a significant need to assess those shelters and provide them with technical assistance so that they discontinue some of the practices that they have now that are discouraging or prohibiting people with disabilities from living in those units or staying in those units. In transportation, last time we talked about rural transportation, regular route, and then the paratransit. Regular route's the bus that goes up and down Broad Street, and paratransit is a smaller bus that would go 3/4 of a mile or closer if you are wanting to transit in that area. So the recommendations that we have here would be to identify current rural transportation options and barriers and limitations to those options. There's really never been a full statewide look at what some of the rural, and there are some really innovative rural transportation options out there that some communities have developed. And that information is not readily available, it's not shared, and we need to encourage more of those options. We would want to identify the regular route bus barriers, and that's the bus that goes up and down Broad Street, and advocate for resolution of those barriers. The buses stop at inaccessible locations, so if you need to get on the bus, you can't get on the bus because there's no curb cut there, or they're dropping you off in a grassy area. You have nowhere to go. So we'd like to advocate for resolution of identified barriers, and the same with paratransit. We'd like to identify and advocate for resolution of those. And then the transportation network companies, the Ubers and the Lyfts, we've got to find a way to get some accessible vehicles in those fleets. Now, granted, I call them fleets, these are individual vehicles. There's got to be a way to crack that nut. We're just convinced there is, but it's going to take some creativity and work with those transportation network companies. In regards to personal assistance services, we're looking at this both through Medicaid and the Department for Aging and Rehabilitative Services that also has a personal assistance services program. Money. This needs money to increase the wages. There are budget items this year, but they're not raising the rates to where they need to be. I know it's an expensive hit. It's an expensive cost when you look across the entire state at everyone who needs these services, but the wage is just too low as it is now. We would, one of the other issues, because the wage is so low, is there's just a severe shortage of people willing to work in this field. But we do believe with some creative training and outreach that we might be able to tap into some untraditional folks who have not provided these services. And so we would propose to provide some outreach to improve the recruitment. Medicaid Works is that Medicaid program that allows an individual to go to work and earn a higher income but maintain their Medicaid services. And the program's there. The program's all developed, regulations are there. It's been sitting there very, very underutilized. And so we would really like to see an expansion of outreach about that program so more people will take advantage of it, go to work, and earn those higher wages and save additional money. As talked about in April, it's easy to get in and easy to get out of, easy to get into a nursing facility, but it's hard to get out of a nursing facility. And so what we are looking here for is there had been a Money Follows the Person program, a federally funded, supported, Virginia-operated program to get people out of nursing facilities. That has gone away. And so it's not a very functional program within Medicaid at this point. We would propose to educate screeners. These are the local Department of Social Services and Department of Health staff who determine if people are eligible for these services in the first place, to ensure that they had more and better information about community services and provided that information to individuals to avoid placement in a nursing facility in the first place. There is required by federal Medicaid rules responsibility of the state Medicaid agency to have identified a local contact agency or a group of local contact agencies who are responsible for receiving referrals from people who are in nursing facilities but want or need information to get out. And this has been a federal requirement since 2010. It is just not working in Virginia. The Virginia Association of Centers for Independent Living has some, I think, some very valid ways to approach expanding this network, educating this network, and getting the agencies to work together. And on this issue and many of the other issues that you see in green that Centers for Independent Living are looking to partner with you on, many of these issues could be resolved by somebody filing a complaint, an Americans with Disabilities Act complaint, or bring an issue through a Medicaid appeal. That addresses the issue often for a small number of people. What you see here in green throughout this presentation is an opportunity to try to resolve these long-standing barriers to people for a large number of people, to improve the system, not just to improve it for that lucky person who has an advocate that files that complaint. And then we would, this is a money one, reestablish the transition coordination service as a specific service, a person that helps an individual make that transition out of a nursing facility. Sorry. And then the last category is technology, and that's in regards to state website, local websites, business websites. These need monitored, and then somebody needs to advocate for improving the access. And I know there's been different bills and different efforts over the years, but we still see a tremendous number of state websites that are not accessible to people who are deaf because they are not captioned, or people who are blind because the reading systems don't work with what's in the state websites. And so we would monitor and advocate for access to these websites and also educate the public accommodations. Those are Americans with Disabilities Act Title III entities, banks, private school, places where there's an exchange of money to help them better, to improve their websites for accessibility. So that's our presentation. We thank you for letting us come back again to this meeting.
Thank you, Ms. Hollowell. Colleagues, do you have any questions, or would you like further elaboration on any of the topics? Yes, Delegate Hope.
Can I ask Maureen on that last point about the website? Is that a ADA violation for state website not to be accessible?
Well, that's a great question, Delegate Hope. For the state and local governments that receive federal funding, they have a requirement under the Rehabilitation Act, a specific section of the Rehabilitation Act, but those public accommodations, such as the restaurants or the bank, they would have obligations under the Americans with Disabilities Act. And they often, just one by one, need to be educated or action brought in some way to encourage their access. So yes.
Okay,
So yes, it is a requirement, but it's not being met? Is that what I'm hearing?
That's correct, Senator Fevlola. There's unfortunately a number of businesses, and they're often large businesses. This is something that businesses have to stay on top of, just like they stay on top to keep it current with other information. They're not keeping all of their links, all of their pages accessible. And so that presents a real hardship for anybody with the disabilities trying to do their transactions through those websites.
Sure, Delegate Hope.
Just to clarify, I mean, because my question was about the state websites, but the other is the businesses. That's a different issue, I think.
The state receives enough federal money that they would have a Rehabilitation Act requirement,
Okay.
as well as under Title II of the Americans with Disabilities Act, the states have an obligation to make their websites accessible. So it's kind of two places.
So they're not meeting those obligations, I think is my question. And
You're right, they are not.
Do you know which ones? Can you tell the commission which ones do and which ones don't? Or more importantly, which ones don't?
We could, commission members, we could tell you for that day what we have seen that day.
Okay.
But as soon as an entity changes, adds, removes something, it changes language in that programming for that website, and sometimes something that was accessible this morning, somebody adds something, somebody changes something in that company or the state agency and makes inadvertently the website inaccessible, or that page, or that new information. And so it is, yes, we could tell you the ones, because we get calls all the time. I can't do this online. I can't, the Department of Motor Vehicles, I can't access something I'm trying to do.
And you're saying
We will raise that issue and they'll try to fix it. So I could say yes today, the Department of Motor Vehicles, and they may have fixed it last night. We could go there tomorrow, and I don't know until I go there tomorrow. There's not enough diligence in the maintenance of those systems.
But you don't seem to think it's a cost issue.
No, because government shouldn't be posting something unless it's accessible. And so any more than it's a color issue or a font issue or a determination to have 45 pages instead of 12 pages on the website, it's a cost of doing business, not an extra cost in developing, and it shouldn't be an extra cost. It should be what the cost is of doing business, or in that case of state government, the cost of developing that and maintaining that website.
Mr. Tollers, Commissioner Tollers.
Okay, the transportation thing, even whether it's better. The transportation section is a little confusing about whether
your center is talking about rural transportation, because I think the problem you described is not limited to rural transportation. It could also be a similar problem for urban transportation. Like I live in Northern Virginia, and we have many of the same problems you mentioned here. And I was recently in Roanoke, Virginia, and I had difficulty figuring out how to use the Valley transportation system in Roanoke, and no, Roanoke doesn't look rural to me. I suppose you could call it small town, mid-size town transportation, but I think center in serving heavily urbanized area, suburbanized area, and I suppose small town area like Roanoke should also be encouraged to deal with these problems, these issues.
Commissioners, yes, you're right. The issues in rural transit are primarily that there is no transit.
Okay.
In more urban areas such as Northern Virginia or Hampton Roads, where I'm from, we have many more transportation options, but they're often not in compliance with the requirements of the Americans with Disabilities Act and scheduling and how they operate and other factors. And so we kind of see these as being addressed differently. The need in rural transit to just identify some unique, workable programs that we could promote and work on at a community level to expand, and then trying to resolve the problems that people who have transit but aren't able to use it efficiently or effectively because it's not in compliance. Identify those issues and work on systems resolution of those compliance issues.
Thank you very much.
Colleagues, are there other questions?
Chair,
Yes,
if I could
Delegate
ask-
Washman.
If I could ask a few questions. On the front page, it lists the independent living service areas that are delinquent, rather. I noticed that two of the counties that I represent, Brunswick and Greensville, are there. I represent a very rural area, and as far as transportation, I think some of the comments are right. It's not that we don't have curb cuts, we don't even have curbs to cut. So there are no, I think it's like one city bus line and maybe Emporia. Brunswick is trying to do something else, but there's nothing else that I'm aware of in the district. I'm surprised that Sussex County is not listed in this list as well, too.
Delegate, are you looking at the list of unserved areas?
Yes.
Right. Some of those centers or some of those counties are served by an existing center for independent living, Sussex being one of them. And I'm not off the top of my head if that is by the satellite that's down by Petersburg, or if that is more, is that Northampton County?
No, Southampton's in the district, but that's western Tidewater. Sussex is
Right.
below Petersburg. At one time, I think Crater Planning was sending people to the Jarrett Community Center like one day a week. The last time I knew that I thought they had cut that, but maybe I'm mistaken.
They have a Center for Independent Living satellite office there and have had for 10 years or more. It's just never grown into a full-fledged Center for Independent Living. They are a satellite off of the Resources for Independent Living, the Richmond Area Center.
Okay. I guess I need to get with you offline to find out where that is. I think I mentioned about the transportation issues that we have.
Follow-up question?
Yes, or a different
Okay,
question,
Delegate
actually,
Washman.
if that's possible. I think at the last meeting, we talked about centers in the area, and it was said that we didn't have any in that part of the state.
We have, Delegate, there is a Center for Independent Living in Richmond area, and they have a large satellite office in Petersburg. And they serve some of that county, or that full county, Sussex County, but they serve some of that area. They are ready to become a full-fledged center, and it is a matter of resources.
Okay.
Yeah.
We talked about some of the personal care services. This morning, I had quite a lengthy phone call, and you're right, it's reimbursement issues. The amount that they're allowed to get by Medicaid, by the time the benefits are taking out of that money, it's put those people working at the personal services right at minimum wage. So the agencies I've been talking to, they're losing their staff left and right. They can't take staff. They're having to deny clients that they currently have because they don't have any staffing facilities, staffing support to go out to these homes and take care of individuals, which I'm kind of seeing that happen in a lot of areas of healthcare. We've also lost pharmacies in the district because the reimbursements, particularly through Medicaid, that they set is far below their cost and even far below what the state says those dispensing fees are. With transportation, going back to that, we mentioned Ubers. I don't even know that we've got Ubers in our district. We're so remote. It's nice to hear of some of these improvements in some of the urban areas, but as someone who represents a very rural area, it's kind of frustrating because we lack those facilities in the first place. And I don't know that that's a question. It was more of to give you an idea about where my concerns are with this situation.
Ms. Hollowell, do you want to respond or just leave the comment as is?
Well, very quickly, we would agree that there is a severe shortage of transportation available for people in rural areas. It's even more severe for people with disabilities in those rural areas. And it is the top recommendation on our transportation recommendation list is to try to learn more about where there is successful, affordable rural transportation for people with disabilities and promote and share that information with the hopes that we can establish more rural transportation for people with disabilities.
I'm just curious, has there ever been a state grant program that has been made available for providers to create a transportation network that is specifically aimed at providing services to individuals with disabilities?
Senator Favola, there has been, and some of that has been state money. Most of it has been federal money. Back in the early 2000s when there was this Olmstead decision, a court decision about institutionalization of people with disabilities, there was some federal money that came to our state for these local demonstration projects. And many of those now are up and running and remain up and running. But of course, that then took some sustained funding from the local community to keep those going. And that's some of what we really want to look at how they kept those going, what's been successful, what people with disabilities feel they have benefited from, and try to expand that knowledge. But the new funding hasn't been available for some time.
Hasn't been as robust, maybe not even as available. Okay, colleagues, if there are no further questions, oh yes, Delegate Scott.
Thank you, Madam Chair. Just a couple things I'd like to kind of follow up on. The first one is like you mentioned trying to encourage like an Uber type service for folks with some sort of disability. And I'm just trying to wrap my head around that one. I've got a daughter who's mobily challenged and requires a very unique set of equipment. And we've looked at getting a medically equipped van for a family to have some sort of lift or whatever it might be. And those are quite expensive. And then when you throw Uber into this, I would venture to say nobody has ventured into this because there's just no way to make money off of it. Because the cost of that vehicle and the insurance to go with that vehicle, and then the amount of rides they would have to be able to service in order to make sure they're paying for their gas and their insurance and all that stuff would just be not reasonable. I'm a big advocate of capitalism. Private business can do it best. And I would say if private business hasn't figured out a way to do it, it's because we're just not there yet. But it doesn't mean that we can't get there, but it means that we need to see what we can do to try and figure out the best way to get that done. Then the next thing that I would like to touch on, Madam Chair, if I may, is returning back to the websites. You mentioned state agencies, and I got that, tracking that, but then you also mentioned businesses. Where is the defining line of a business that's required to have ADA accommodations on their website versus a business that's not?
Senator Favola?
Yes, Ms. Hollowell.
On the TNC, the Transportation Network Companies, there have been other states with legislation and/or complaints, and the Transportation Network Companies in those regions have risen to the challenge of providing accessible vehicles. And I think some of that is private market driven because there is a need. And unfortunately, the needs, more people in urban areas. So that's probably where we would start. But yeah, it's worked in a TNC environment with encouragement from the TNCs in that region of the country as well as the state. And in Virginia specifically, about a dozen years ago when Virginia had its first TNC legislation, Virginia was one of the first states to put language in there about accessibility for compliance with the Americans with Disabilities Act for people with disabilities. So we've kind of already dipped our toe in there with the TNCs that are operating in Virginia, but it's going to take a lot more discussion and a lot more explaining the need to them, I think, but it has worked in other states because it is a for-profit venture.
Just as a follow-up to Delegate Scott's question, maybe you could provide the commission in writing with some examples of where it has worked and what conditions have been in play, just so you have that information.
Yeah, Madam Chair, if I may continue.
Sure, Delegate Scott.
Because you had mentioned banks and other, and I would agree that it would be a wise business decision for them. But I've also dealt with website design myself. And depending on the complexity of a website and then adding on to those features, the comment was like, it's not just like a switch that you can turn on, turn off. There is a whole bunch of coding that goes into this, and there is a huge expense that goes into revamping a website. Many of us up here know the smaller costs associated with having a campaign website. But when you get into a corporation that has billing and customer service and all these other different features, adding those in can be a quite lengthy process and a very cumbersome process. And I've even seen where companies have tried to renovate a website, add in some of these features, and totally crash the website. And then kind of put them back to square one. And so those are the things that we have to be mindful as we move forward with any type of legislation is that cost that is gonna be put on that business, or even the state agency that may not already be doing it. I guarantee there's a funding issue associated with that.
May I address?
Ms. Hollowell.
On the accessibility of website issues for state government, it's been a requirement. It's nothing new. It's just a matter of following through where things become inaccessible for many of the reasons that delegates described. In regards to the Americans with Disabilities Act, Title III, public accommodations, private businesses, they would need to do modifications of policies, practices, and procedures to ensure that their business is accessible, including their website. And that will vary based on the size and resources available to that business. The ADA has a various standards of undue burden, undue hardship for employment situations. So there are already well-established parameters in regards to cost for private businesses in the Americans with Disabilities Act for Title III entities, not state governments. State governments should be accessible.
Okay, we agree. I think the issue of implementation is a bit more complicated than what it appears. Colleagues, to bring this
Senator Favola.
Conversation to conclusion. Oh, yes, my apologies. Commissioner Brunk.
I just wanted to echo what the delegate was saying about rural transportation. I also live in one of those areas that has no sidewalks, no curb cuts, no transportation. We serve probably the largest geographical area that is rural up with Augusta County, Bath, Highland, Rockingham County. And one of the challenges, I'll disclose I was on the local school board for a term. One of the challenges I find is we invest so much money in our students to educate them, and then they graduate. And if they live in one of those counties that doesn't have any transportation, oftentimes we as counties can figure out how to get you to a doctor's appointment, and how to get you to the bank, but we can't figure out how to get you to employment. And that's such a huge, to me, that's a loss of return on investment. When we've got our students sitting at home because they can't get to employment, or their only option is to pack up and move to the city, the one area that has transportation, and we like to keep our people. So I hope that we can continue to have these conversations and find a way to address our transportation barriers, because it's a barrier to where we live in our beautiful Commonwealth. And I would say, looking at return on investment for the amount of money the state contributes to education, I certainly would like to see our students gainfully employed.
Well, the Medicaid coverage of transportation has improved somewhat, so we'll also have to look at some of the Medicaid service items under the transportation. Thank you. I'm going to ask staff, we're going to keep a list of recommendations, so when it comes to perhaps our November meeting, we'll be able to vote on recommendations that we can go forward with for the legislative cycle in 2024. So on the funding recommendations that were noted on slide 4, I think I would like to have the Senate Finance or House Appropriations Committee look at the recommendations on slide 4 so we can get maybe a more accurate, if you will, estimates on budget impact. And there's a lot of interest in the transportation recommendations, so I think we would like a couple of recommendations on how we can improve access to transportation, especially in rural areas for individuals with disabilities. And we should come up with 2 recommendations in the housing area. So we will have formal recommendations that will come before the commission, which we will vote on to put our mark of approval, so we can hopefully make some progress in the 2024 legislative session. Thank you, colleagues. I will ask staff if we're ready to listen to the less restrictive income methodologies by Kelly Pauley. Can we go back to that? Have we figured out the technology?
Madam Chair, if Kelly Pauley is ready, we can go to her.
I'm here. Can you hear me? No?
If you can continue speaking for a minute, maybe just do a mic check, 1, 2, 3, repeatedly, if you don't mind.
Okay, I'm sorry. Still trying to see whether you can hear me. To talk about less restrictive income methodologies. Still checking to see if you can hear me.
Thank you very much. I know it's awkward, but if you could keep doing it, we would appreciate it.
Okay, I'm sorry. All right, still checking. Looking at the screen and hoping that.
Hey, Ms. Pauley, give me 1 second. I'm gonna, if you can stop sharing. Give me 1 second, all right?
Okay, I'm not sharing.
You wanted to just do audio? You may have her just try calling in.
If she could call in and we can see the slides on the screen, that would be helpful.
Ms. Pauley, would you mind speaking now?
Yes, I am trying again to see whether you can hear me.
Yes, if you can't hear us, we believe we're going to have you call in, if you don't mind. Could you go ahead and, mute that and call in. And I'll pull up the presentation, and you just say next slide, and I will move it to the next slide for you, okay? Do you have the phone number on the Zoom link that was sent to you?
Yes.
Okay.
1 second.
Go ahead and take a moment and give us a call.
Is this going to work? Mr. Frank? Well, you...
Okay. I called in, but it says I'm mute.
Ms. Pauley, if you could go ahead and try again.
Okay, now it says I'm muted.
I think it might be better if Mr. Frank maybe goes over the slides with us, and if there are questions, Ms. Pauley can then answer them. Would that work?
She mute her computer. Oh, she is.
Yes.
I hear that echo.
Welcome, Mr. Frank. Now, you are the legislative liaison for DMAS, is that? Okay.
Medical Assistance Services. Sorry about this. I think the technology. I can go ahead. Kelly is definitely our subject matter expert, but I can review the slides with you and we can follow up with any questions you have. As Ms. Kelly said, this is a follow-up presentation to previous presentations we've done here. Senator Favola and we received a request from the Senator's office and got some information from Congressman Byer's office to look a little bit more into these federal regulations. And prior to the publication of the final regulations, states were greatly restricted in their ability to use less restrictive income methodologies. Under these sections of regulations, final regulations became effective May 11, 2001, giving states greater flexibility to use less restrictive methodologies. The income guide, less restrictive resource methodologies, which I believe is what Ms. Kelly looked into, is simply conveying information regarding these regulations. Disregard that where already in effect the implementation guide itself did not do anything new. What is Section 1902 R2 and what does it do? This section is a provision in Medicaid statute and is used as a kind of shorthand expression when describing what the provision itself does. States are required to follow the same rules and processes used by the most closely related cash assistance program to determine eligibility. For age blind or disabled, those would be the rural supplemental security, SSI program. For everyone else, those would be the rules of the former aid to families and dependent children, AFDC program. Using the same rules as the cash assistance program means the states start with the same amount and type of gross income and resources as the cash program. Disregards, meaning subtracts the same things from the person's gross income and resources, a process known as methodology. I lost the slide.
Now what happened?
Continue? Okay,
Go ahead.
sorry about that. The use known as methodology arrives at the same amount of countable income resource that a cash assistance program would if they were determining eligibility in their own programs. This section allows states to use less restrictive income and resource methodologies in determining eligibility in the most Medicaid eligible groups than are used by cash assistance programs. This means that states can elect to disregard different kinds of greater amounts of income and/or resources that cash assistance programs do. Going through a few definitions: eligibility group, a classification of covered groups based on non-financial resource and income requirements used to evaluate and enroll individuals to report statistical data for federal reporting. Home and community-based waiver services, a variety of in-home and community-based services reimbursed by DMAS that authorize under Section 1915C waiver designed to offer individuals an alternative to institutionalization in a medical facility on the documented need for the services or services to avoid nursing facility placement. The questions that we had received that we put together answers for, again, this is presentations based on those list of questions that we wanted to get back to you on. Are states allowed to apply 1902 R2 to individuals receiving home and community-based waiver services, while Section 1902 R2 disregards can apply to individuals receiving home and community-based waiver services? States cannot target such methodologies specifically to HCBS waiver recipients alone.
Right.
People do not become eligible for Medicaid because they received HCBS. HCBS are just that, services that a state can elect to provide to individuals who are eligible for Medicaid to receive HCBS through a person must be eligible for Medicaid under one of the eligibility groups covered under the state Medicaid plan. If a state elects to apply Section 1902 R2 disregards to a particular eligibility group, the disregards also applies to the individuals receiving the HCBS. A state cannot apply Section 1902 R2 disregards only to individuals within a group who receives HCBS. The 1902 disregards must be applied to the group as a whole.
So point of information, so I read this to mean that everybody eligible for Medicaid would also be eligible for whatever income disregard the state were to adopt.
That is my understanding. I don't know if we can hear from Ms. Kelly to answer that question. Not at all. I would have to, that's my understanding, but I would have to confirm with her.
I understand. Because that in effect makes a very large financial impact.
Go ahead, Ms. Holloway.
Can you hear?
Yes.
This is Ms. Polly. Can you hear me?
Yes.
I just wanted to tell you that what that means is anybody in a group, so everybody who is age blind and disabled would have to be given the same disregards. That's what that means. So not everybody on Medicaid, but everybody within a certain group.
Within the disability group, say.
Correct.
Thank you.
And Madam Chair, I think we can hear her now. Do you want her to pick up where I left off? Or?
I'm fine with you going through the slides. We're
Okay.
on a roll here, and
Okay.
she can answer any questions. I'd rather not have further interruptions in the
Sounds good.
presentation.
Next question, can income or asset disregards within the medically needy group for age, blind, and disabled be different for people who are institutionalized and those who are not? No, less restrictive income or resource disregards cannot be applied based on living arrangements or institutional versus non-institutional status, and there's the regulation there. Can states disregard just a specific kind of income, either earned or unearned? For example, can states disregard just Social Security, disability insurance, SSDI income, or just interest income from savings account? Yes, states can choose to disregard specific kinds of income. Either or both the types of income in the example could be disregarded for an eligibility group under Section 1902 R2. Any questions on that?
Colleagues? Okay, continue.
Can states disregard just a specific kind of income, either earned or unearned? For example, can states disregard just Social Security, SSDI income, or just interest from savings? Yes, states can choose to disregard specific kinds of income. Either or both of the types of income example could be disregarded based on Section 1902 R2. Can states disregard income that is used for a particular purpose such as income put into medical savings account or income a person uses to maintain or repair a home. Yes, a state can choose to disregard income that is used for a particular purpose. For example, a state could have a disregard which could, but does not have to be limited to dollar amounts for income used for home maintenance or repair. Can Section 1902 R2 also be used to disregard income as part of the post-eligibility treatment of income process? Medicaid statute limits the use of Section 1902 R2 disregard specifically to determination of eligibility. Since post-eligibility treatment of income is not part of eligibility determination, Section 1902 R2 disregards cannot be applied to income used in post-eligibility treatment of income to determine patient pay liability. That means that even if we disregard the income at intake, it will still be included when determining patient pay.
And well, this is Kelly Polly again. This is really the key point. We could have different income disregarded at the beginning. We can set income aside in accounts that would be disregarded. But even if we did all that, we would still have to include that income when we're determining the patient pay, which is how much cost sharing the individual has to do to pay for their services.
So may I ask a follow-up? Yeah. So the way you explained it, the cost sharing that a patient is paying now may not change even with incomes that were disregarded up front.
That's right. And that was the biggest surprise to me, and I checked with CMS specifically about this piece of information because I wanted to understand what they meant by post-eligibility treatment of income. So they're not talking about application or renewal. They're talking about patient pay. So even if we disregard the income at intake, we would still have to include it when determining the patient pay. So it would not result in them actually keeping more income.
So it would not result in them keeping more income, which is very interesting. Okay, thank you.
Moving on, how many individuals would be affected? More than 400,000 Medicaid recipients are age 65 plus, blind or disabled. All could potentially be affected by changes in income disregards. In addition, other Virginia residents could become eligible for Medicaid. Next steps, DMAS continues to research ways to increase accessibility to Medicaid for working disabled individuals. Medicaid Works application process will be updated and streamlined during the next year. And as recommended by the governor's introduced budget, DMAS is working on operationalizing the requirements to allow developmental disabled waiver recipients to also enroll in Medicaid Works. And that is it. Happy.
Just a quick question, Ms. Polly, could you briefly explain the Medicaid Works program, just so we're clear on that?
Yes, Medicaid Works is a program that people can apply for where they can work and retain more of their own income through using a work incentive account, a WIN account. And so what we are going to try to update is we discussed with CMS some flexibilities with Medicaid Works, and we will be adding the WIN account to the intake process, which means you could set up your WIN account before you're actually in the program, just during your application process. That means that if you had assets higher than the Medicaid limit right now and you were applying to be in Medicaid Works, then you could set aside more of that money up front. So when somebody is in Medicaid Works, they're able to earn more money than you would if you were just in regular Medicaid and retain more of that money.
And in the past, you have not been able to be in the developmental disabled waiver at the same time. But that was in the budget, and so we're working on figuring out how to allow those waiver recipients to also enroll in Medicaid Works. People who are on other waivers can already enroll. There are some operational challenges with the waiting list, so we're working on how to do that requirement.
Okay, that adds clarity. Okay, colleagues, the discussion's with us. Do we have any questions? I know we have a speaker who is very interested in this, so in fact, Mr. Finley is the one that went to Congressman Byers' office to get more information. So now the committee is informed. Mr. Finley?
Thank you, Madam Chair and members of the committee. I have 3, maybe 4 points I'd like to make. The presentation on its whole was actually quite good, quite clear. There's one point, my first one I don't know where the disconnect is. And I'm reading from DMAS's presentation. States cannot target such methodologies specifically to HCBS waiver recipients alone. Right. That's actually just the opposite. As a part of the information I sent to you from Congressman Byers' office was their slide deck prepared by CMS. And I quote from CMS's slide deck. A state that operates more than one 915C waiver could target a disregard at individuals who meet the coverage criteria for one particular waiver. That contradicts what is said in the DMAS presentation, but it may be a language issue, I'm not sure. So what CMS has described to us through Congressman Byers' office is that Virginia has 4 waivers. You could pick 1, 2, 3, or 4 of those waivers to apply a particular income disregard to. That is point 1. My second comment has to do, in the DMAS presentation, the Medicaid statute limits the use of Section 1902, the new regulation, disregards to specifically to determinations of eligibility. And that is an important concept to understand. The income disregard does not mean a disregard for the financial obligation of the individual, like patient pay. It's simply to get you there. And the problem I presented to the commission back in the fall was either someone like my son who's just below the income eligibility for Medicaid because he has SSD on my deceased wife's work record, which Social Security requires, or someone who has SSI and a parent dies and they are required to go on SSDI and it takes them over the Medicaid limit, they lose everything. And we're talking about profoundly disabled individuals. So that was made clear in the DMAS presentation, and that's just important to emphasize. Eligibility income is separate from income obligation, so the state is not losing money. The other item that I think it's a bit of a kind of a boogeyman, it says more than 400,000 Medicaid recipients are age 65 plus, blind or disabled, which could be potentially affected. Again, the problem I brought to you was very specific to individuals who have a medically funded disability waiver. Those waiver slots are controlled by the legislature. You can't expand them unless the legislature says so. And so what we were requesting was that this particular one apply to if you're 1, you're a disabled adult child, 2, you have an approved Medicaid funded waiver whose numbers are strictly controlled by the legislature and they would not increase, and 3, only to disregard the amount that is the SSDI income penalty that's imposed by Social Security requirement to migrate from SSI to SSDI when one of your parents retires or dies. And I did get a direct answer from Social Security on why this policy exists. SSI is a is applied for when someone is disabled, and it comes out of the general U.S. Treasury. SSDI is dedicated money on another federal account, and they want to do anything possible to take anything that comes out of the general United States Treasury, and this is one way that is done. That is why this requirement exists, and that is directly from the Social Security Administration. What they don't understand is the penalty. So to reiterate this in ways, I'm an architect, so I like visual kinds of analogies. So if you think of water as the regulation, that previously you had to fill the entire ice cube tray, put it in the freezer, and freeze all the ice cubes. What CMS is saying now is that you can use your water, your regulatory authority, to fill only one of the ice cubes. Simply put, you can use this new regulation to apply to only one of those ice cubes in the tray. It is remarkably flexible, and for the 5 years that I've been working on this issue and read all the federal regulations and state regulations that are as dense as anything you want to read, if you read this, you go, wow, somebody knows English. It's very clear. The last point I will make has to do with Medicaid Works, and that was suggested early on as a solution. And as has been noted right now, if you are on a waiver, you are specifically excluded from using Medicaid Works. The purpose of Medicaid Works is sort of a safety net. As you try to migrate off Medicaid and get a job, it provides a transition to sort of provide the safety net while you try to get on your feet, get a job, and get off Medicaid. And back to my son and those that we're advocating for this very narrow policy, one little cube in the ice tray, we're talking about profoundly disabled individuals. My son has an IQ of 48. It is not going to change. That is the segment we're talking about. And remarkably, and you can imagine any federal regulation that comes out has a lead time of years. Somehow, some way, CMS recognized that all these overlapping state and federal regulations were creating problems. And they've given states a tool to untangle it and target specifically those individuals who are being affected, like my son.
Thank you, Mr. Finley. Of course, your interpretation varies from what DMS just described to us. Without going into any more detail on your son's specific situation, I'm just curious about the Medicaid Works issue. Ms. Pauley, is Medicaid Works really intended to be the bridge to help individuals get off of Medicaid and then at some point in the future achieve full employment? Is that the goal here?
The goal is to allow disabled individuals to work and to earn more money than they would if for regular Medicaid recipients. And certainly the long-range goal would always be for someone to be able to make so much money that you would not be eligible for that anymore and would pay for your own insurance. But it's not a requirement that they move in that direction.
So, for argument's sake, somebody could be on Medicaid Works for an unlimited amount of time.
That's right, they could.
So that could be an avenue for Mr. Finley's son.
Yes.
Mr. Finley is saying no. And I think this will be the last bit of conversation on this case.
My son has a waiver and an excluded. I read that there's a move within the governor's office to bring them in, but because of the community living waiver, he lives in a group home and all the other services that are bound into that. I think my understanding of Medicaid Works, and both the Congressional Research Office offered that as a solution. When I explained to them what it was, they understood that was not a solution. Is that it's someone who is more capable than individuals like my son who are profoundly disabled. Does that make sense?
Well, in the past, we have not been able to let people who are on the DD waiver into the program, but the governor's budget has asked us to do that. So we are working on operationalizing, allowing developmental disabled waiver recipients to also enroll in Medicaid Works instead of having to choose. Currently, they do have to choose, and they can only be on both for 6 months. But we are working on how to operationalize having people be both on the DD waiver and in Medicaid Works, because the current Medicaid Works program provides personal care, but that's the only service outside of regular Medicaid.
I think we're trying to make it work, Mr. Finley. Yes,
Senator
Commissioner
Favola, I'm just going to admit to being a little bit confused, so I don't believe in being completely clear by the end of this meeting. So I own that.
It's fine.
I think that's going to take a little bit more
It's
time.
okay. We're going to continue to have a conversation.
But the question that I have is, I understand that we're looking to break down one of the barriers of allowing individuals that are on the DD waivers to be part of the Medicaid Works. Are we also looking to revamp the Medicaid Works program so that this income counts as work when they're not working? I mean, I think that's part of the crux of the question is, if we're looking to open it up for Medicaid Works, that implies that the individual is employed making more income. Are we saying now that we're going to take this additional income that the individual is receiving and put it into that program? I'm just a little confused.
I think we need to ask Ms. Pauley on how, because the program is in transition. We're bringing in a new category of people, those on the DD waiver, and they have different needs than other categories. Ms. Pauley, did you hear the question, and would you like to respond?
I did. We are working within what is already approved for Medicaid Works. So I don't know that that what they would be allowed to keep would be different. We're trying to make the program easier to get into and make it clearer for the workers who are the local benefit workers, who are the ones who would be telling people about the program and maintaining it. So we've got to, that whole having the WIN account up front. If, for instance, if your resources were over $2,000 right now, you wouldn't be able to get into Medicaid. But if we allow you to set up your WIN account at intake and put some of the money in there, then you would not have to spend down to $2,000 to get into it. So we're looking at what we already have authority to do and trying to streamline it and make it more open. But we wouldn't be changing what the income limits are or the patient pay requirements. The Medicaid Works people right now don't pay any patient pay, but I don't think we would be able to do that for the DD waiver people. But we will certainly be, in conversation with CMS about what we can do for them going forward.
Okay, that's a fair answer. Mr. Finley, last comment?
As I've discovered over the 27 years of the life of my son, when I've run into a problem that I went after for him, I discovered that it helped others in the disability area. And as I began this quest, which was he couldn't work after he had been trained by his local school system to work, I discovered that this was a bigger issue, and that is people like him who have a DD waiver, who have SSI, and they have a parent who retires or dies. Because of the amount that SSDI can be, it's over $1,000 over the Medicaid income limit. The scenario, as it was painted to me by our local Medicaid agency, was we have people who have a Medicaid waiver, they have a group home, they have SSI, they may or may not have a group home, and then a parent retires or dies. They typically don't know this is coming. And so you can imagine someone who's medically fragile, is in a group home, where everything is set up, and the parent dies, they lose it all. This is not about Medicaid Works. This is not just about my son anymore. And that's what I discovered once I got into this. So it would include those people who are living, are just alive because they have a Medicaid funding waiver. A parent dies, they're out. And then people ask me, so what happens to those people? And all I can tell them is very bad things happen. If you want details, I can offer them.
Ms. Pauley, maybe you and Dennis Finley can connect and see if there's a way that individuals in a situation that Mr. Finley has described can remain covered under our Medicaid disability waiver in situations where a trust fund may be available.
We can certainly discuss that further.
Okay, Delegate Hope.
This is an important issue, and I just want to make sure that we have a next steps. I think we've done some research to find out what's a federal obligation and what the state obligation or flexibility is. And I was hoping to learn what other states are doing, but I would still like to understand how other states are doing, and I would like us to come back to this issue in the future to find out what our options are and what the costs might be, if there are costs involved in that, so that we can figure out what we do next. Because I think we should take action.
Yeah, I think this is a problem, and the way we're trying to solve it, I guess the slide that says more than 400,000 Medicaid recipients could be affected by the change in income disregards. I think that's where the big price tag is. So I'm wondering, I mean, based on Mr. Finley's comments, if in fact our interpretation is broader than it needs to be and we can actually limit it to individuals under very specific circumstances, maybe on the home and community-based waiver. I don't know. But to your point, Delegate Hope, I guess I will ask, and my apologies, but I will ask DMAS, and it might fall to Ms. Pauley, to dig around a little bit more to see if we can find a narrow pathway that doesn't break the budget. I understand there'd be some budget implication, but something that doesn't break the budget that would help individuals like Mr. Finley's son. And in your research, I'd like you to pick up what other states are doing, because I have to believe other states tried to narrow this as well. Is that adequate, Delegate Hope?
It is helpful, and I'd like to hear whether DMAS would actually do that. Can y'all do that? Can you put together a work group or come back to us with report back on what options that we might have?
Mr. Frank?
And I'm kind of curious to whether or not this is a legislature issue or it's an administration issue as well, too, in terms of addressing it.
So I would recommend if you as the chair want to send us a request, a formal request, we can go ahead and take a look at that and respond to that and see if that's something we'd be able to do. I think that's probably the best avenue to take.
Which is the avenue I used last time, and I'm sorry I have to burden you, commissioners. You're hearing everything as we're learning it as well. Yes, Mr. Tolis.
I would appreciate if you.
I thank you. I would appreciate if you, Mr. Bingley and your colleagues can write up a sample case, obviously involve very personal thing, so it should just be a sample case, individual, you could call him John Doe, Shane Doe, whatever, and obviously not the real fact of one specific person case, but similar case with all the number, what terrible thing happened now, and the change that you're proposing, what the change it would do to make things better for John Doe, for instance, a sample case, so we can see how it would work in the real world, but obviously it shouldn't be a specific real individual.
Thank you.
With the commission's consent, I will write a letter to DMAS trying to capture what I think the issue is and ask for additional information and some best practices on what other states are doing. And then we'll take it from there, colleagues, if we want to set up or we ask DMAS to meet with stakeholders. We'll first respond to my letter, and then we'll see what the next steps are.
Thank you.
Thank you. Okay, The next topic, thank you, Ms. Pauley. You have been incredibly responsive, and I know we're giving you lots of assignments.
That's fine.
Thank you. Colleagues, I'm going to blend item 5 and item 4 together, if you don't mind. Before you is a draft copy of an electronic meeting policy. This commission never adopted one, and it has come to my attention that on occasion, we might have members who would want to participate virtually. And the proposal before you, we tried to, or my request was that it look like other proposals which commissions have adopted so we can have some uniformity. This is the proposal that the Joint Commission on Healthcare has adopted. So I'm going to ask you to take it home and digest it. We will vote on it in September. If you would like a presentation, I can ask Mr. Marin to walk us through the highlights. Why don't we do that before my colleagues are given an assignment to take it home and digest it?
Well, you summarized it very well, Madam Chair. It is following the policy put forth by the Joint Commission on Health. And it mostly follows the statutes already in place. And there are just 2 exceptions that the Joint Commission opted to go for. And those are outlined towards the top of the policy. And the exceptions being if a member lives more than 60 miles away, that would not be an allowance for remote participation, and also that members cannot vote or make motions when participating remotely. But the remainder of it then follows closely to what the code requires for these meetings. But yes, if you have any questions.
The next paragraph, it says members are permitted to participate in meetings electronically under the following 3 conditions. So the goal, when the Joint Commission on Healthcare discussed this, we wanted to have an incentive for people to appearing in person and using the virtual meeting only when necessary. So we created a carve-out that is more narrow than the current statute, but other commissions are also using it. So I've put it out there for public review. Yes, Commissioner Brunk.
Senator Favola, may I ask for a point of clarification on this?
Yes, please.
Okay, so under the all virtual meetings section, number 3,
yes,
where it says the electronic communication means used allows the public to hear all members. Do we have the ability to interpret here as see as well, since we're the Commission for Individuals with Physical and Sensory Disabilities, to make sure that any interpreters are prominent on the screen so that they can access that? And then the closed captioning, I mean, I don't blame AI for not knowing my last name or picking up on any speech impediments that I have, but it usually gets me wrong a lot of the times. If we can make sure that before we archive things, that somebody takes a chance to look at that, make sure the captioning is more accurate. Is that something that we can incorporate into the policy?
I'm not sure that would be part of our remote participation. I noticed that the first part, if a member is participating remotely, they can't make motions or vote or count towards the quorum. But they obviously, we want them to understand whatever presentations are coming forward. So we should be doing what you suggested anyways, regardless of whether we have remote participation. So I will ask staff to look into that.
Yeah, we can look into ensuring that these best practices are followed.
I think these best practices should be at each meeting. Delegate Hope.
Madam Chair, the part I'll just point out to the Commission that I don't like about the Joint Commission policy is one that is really at the discretion of the Commission. And that is the point that you made about if you are participating remotely, which you're allowed to do, you're not permitted to vote. I do think that everyone should make an effort. I certainly make an effort to come here to vote. But there may be good reasons why you're not here in these chairs. And it could be we just went through a healthcare scare, as you all know, and it's not good to force people to come to vote. And so I just wish that we would amend our policy that would permit that if you're not coming in for a good reason, it should be a good reason, it shouldn't just be made, and maybe it's a discretion of the chair.
You're limited to only a quarter of the meetings where you could say.
That's right. You are limited
No,
anyway,
so
as
you're
it
limited,
is.
yeah.
But you are permitted to vote. And I think that matters a lot to the legislators up here because at the very last meeting, there may be things that we need to vote on. And it would be awful if people, and it works both sides of the aisle, aren't here and can't vote remotely. And so we're permitted to do it. We're allowed to do it. The Joint Commission policy is a little stricter than what the statute provides. I just think that as a disability commission, we probably should allow that opportunity for people at the discretion of the chair if they are not present for good reasons.
So they would count towards the quorum, and they would also be able to vote, or is that?
Under the statute, you have to have a quorum present. But
Okay.
after that, if there's one person or two people that can't be here, they should still be permitted to vote, is my point.
Okay.
You still have to have that quorum present.
Okay, well, that is a thought that we can certainly talk about when we adopt the policy in September. Yes, Commissioner Cholas.
Hi, I just have a question. I mean, I was not able to go look up section 2.23708.3 of the Code of Virginia. But, you know, there was this number 1, and I pulled number 2, the number 1, you know, I don't know whether it's a mandatory allowance or just the optional allowance for people living more than 60 miles away from the meeting site to attend remotely. And does the state statute say this is something a commission can do or not do? And or is it a requirement of state law to allow people who live more than 60 miles away to participate? No, disregarding the exception you have, proposed exception you have here.
Yeah, so in the Code of Virginia, that's currently a reason for participating remotely that is allowed. And what is currently being proposed is to waive that allowance, though, for the purposes of this policy.
The statute does permit the commission to waive that.
Yeah.
So to still require, to not allow that as a valid excuse.
Okay, I mean, I do think that this exception living over 60 miles away, like me in fact, I don't know where everyone here lives, but I guess the vast majority of the people sitting here live more than 60 miles away, so we just retain it. You know, if it's something that Virginia statute allows us to say, oh, anyone living more than 60 miles away can attend remotely, and never mind the number 1, 2, 3 in the next paragraph. You know, that they don't have to obey it, that, you know, this 60-mile rule would swallow up the requirement. You know, nullify the requirement of number 1, 2, 3 here. You know, that the remote participation had to be for personal reason.
You can still use other personal. You can request for any personal reason. So
I mean, I'm inclined to allow.
Yeah. So
the commission should decide. We forbid the 60-mile rule. We delete the 60-mile rule because it's swallowed up.
Because we have other options.
Right. Okay. And the other thing, it's not clear to me exactly what personal reason is. We seem to be having two terms floating around. Personal reason. You could participate remotely in accordance with the exception proposed in this draft. If you have a personal reason, but there's no explanation of what it is, and maybe it would help if, the staff would provide that, for example, what a personal reason is, maybe, recovering from major surgery, or, a couple of other things like that. And Patrick was talking about good reason, which seem to be similar to, but not identical to personal reason. So
Yeah, I'm not sure the limits to personal reasons, what qualifies and does not, but we could look into seeing if there's a definition in the code for that,
For
or
example,
sort of
a personal or
what
good
examples would
reason,
apply.
or maybe combine them into good personal reason.
Okay.
Yeah.
Okay, thank you very
I
much.
think it's worth noting that if you are exempt, it would be at the chair's discretion, but there would be something recorded in the minutes noted that you had an exemption for a personal reason. And
Yeah, and I will note that for the personal matters, you're supposed to specify to a certain degree of, you don't, I
Doesn't
think,
have
have
to
to
be a lot
be
of
too
detail.
detailed, but, and then one has the option to challenge that personal, a member has the option to challenge that, and then there can be a vote as to whether it qualifies as sort of a part of the process of determining if it's a personal matter that
Okay,
should qualify.
thank you very much.
Thank you for your questions. Okay, colleagues, we have publicly advertised this as well, so we will vote on this September. So everybody has to be here, and then if we adopt Delegate Hope's proposal, your amendment, we'll have something different going forward.
Madam Chair, if necessary, I will second his motion for the amendment.
Okay, well, we've got a second from Delegate Scott, and this commission is different from the Joint Commission on Healthcare, so. But there is a value in having us here in person, so I. We're not disagreeing. Okay, all right. The next thing on our agenda, and the last item, is public comment. So we can first listen to individuals who are here in person in front of us, and then we will go to the Zoom platform. I would ask that comments be limited to 3 minutes. Thank you.
Thank you, Madam Chair, and good afternoon, members of the Commission. I'm Teresa Champion with the Virginia Autism Project, and I'd like to address the Medicaid eligibility, least restricted income methodologies that were discussed by DMAS. In 2019, they put out regulations that clarified their exemptions. And thank you for getting a response from DMAS. CMS put that out. The goal here that we're trying to accomplish is to keep profoundly disabled people from losing life-saving benefits when a significant life event occurs. And this isn't just one or two, onesies and twosies. This is occurring more and more. We're all aging and parents are dying. So these people are already on Medicaid. But DMAS is making it sound like all 400,000 people that are on Medicaid are going to be subject to this. I mean, this is a common, oh, woe is me, we hear from many people when they're presenting on an issue. No, the broad ability to tailor the program is what allows you to specifically target the people that need it. And I'm quoting, states may choose to disregard specific types of income using this section. For example, a state could disregard Social Security insurance SSDI income and interest income from savings accounts. Or a state could disregard only SSDI or only interest income from savings accounts. Those are just examples. So these scare tactics of expanding Medicaid eligibility is just a red herring. You know, some people can earn income. Some individuals can. And that is what Medicaid Works is for. It's not an option for all working disabled. Medicaid Works slowly moves people off Medicaid if that's possible, if they're able to earn that amount. It could be seen as a counterbalance to any small increase in enrollment you might have using this program. But if you don't do this, then these individuals are kicked out of group homes, they have increased higher needs and cost of care, they're involved in the legal system. They're placed in nursing homes, or they have to go to hospitals, or they are involved with the police. Now, that's versus this boogeyman of expanded Medicaid rolls. So that's not what's going to happen. You're already receiving Medicaid. This is not an expansion of eligibility. And I would note very quickly on another matter, If you'd look at business.org and you check on worst paying states for caregivers, the District of Columbia ranks last on our list with caregivers being paid 67% less. Virginia is a close second with caregivers being paid 61% less than the average worker. So we're in the bottom of what we provide caregivers for pay. Thank you.
Thank you.
If anyone online wishes to speak, please raise your hand electronically. Madam Chair, there are no hands raised in the Zoom room.
Okay, and there's nobody standing before us wishing to speak. Okay, ladies and gentlemen, that concludes our meeting.
Senator Favola.
Okay, I'll make that announcement, and I think there's another announcement coming. Commissioner Brunk.
Hi, thank you again, Senator Favola. I appreciate the virtual meeting consideration. I want to go ahead and disclose at this point that with the potential move of the Disability Commission meeting in September, I will not be present. I appreciate the phone call that you placed to me the other day where we could talk through that. Not trying to usurp your meeting, but I welcome all of you to join me with what I will be doing that day. We are holding a community leaders luncheon up in Harrisonburg for all of our elected officials. We have from the federal, state, and local government come. And then that evening, we are having a wheelchair basketball exhibition game that the governor has been invited to play in, as well as Secretary Lohr and many other dignitaries and people in our own local community. So I will attempt to watch it at 2 if I have time in between, but I will not be present, and I'm guessing that counts as a personal/professional reason, hopefully, to be excused from that meeting.
Actually, we will not have adopted it until that
that's
meeting,
true.
so I can't
So I will just
allow
be
you to
online
apply the Delegate Hope's amendment if in fact it passes. But thank you for the announcement, and thank you for all the work you're doing. And somebody's on Zoom. Okay, we'll let them in, and then please close the Zoom platform. I understand there's an individual wishing to speak during public comment.
Lucy Beadnall, go ahead and unmute and speak.
Good afternoon, Commission. I'm Lucy Beadnell with the ARC of Northern Virginia. I just wanted to make a quick comment about two things that had been reviewed today. One, in my hearing of the differences presented between Kelly Pauley from DMAS and Dennis Finley, is the difference between the 2001 flexibilities that CMS allowed and additional flexibilities that were new as of 2019 that were not reviewed in Kelly Pauley's presentation. So just to point out from an outsider's perspective, it seems to me that's the discrepancy, and it's those 2019 new flexibilities that need to be looked at or brought before the commission. The other thing I would note is working with a lot of local and regional advisory boards and groups. Many are also working on adopting virtual and remote meeting participation options, and the groups in which I'm involved, of course, tend toward the disability side of things, and they feel like it's their duty by and large as disability organizations to be the leaders in flexibility, knowing that our community is more likely to need virtual flexibility than others. So just a little bit of food for thought as you all decide what you're going to do going forward. Thanks so much for all you're doing.
Thank you, Lucy. I will ask staff to make an announcement about our next meeting. Time and place.
Madam Chair, we have been given permission to have a meeting on September 21st, Thursday, September 21st from 2 to 4 p.m. We do not have a room locked in yet. I will be working that out with the clerk with the possible move. We're not sure about the room setup yet. So,
okay, colleagues, please mark your calendars. The 21st is our meeting. Okay. Any other comments? Okay, hearing none. Colleagues, I'd like a motion to adjourn. Is there a second? All those in favor, is there a second? All those in favor signify by saying aye. Aye. Anybody opposed? That motion carries unanimously. Thank you, colleagues. The meeting concludes.